deal with you. If no interesting, you can go. If something you can go, but don't disturb, okay? Because firstly, it is the first time to presenting about this topic in the lecture. You should help me, okay? Because I'm not lecturer, but I will try to explain about this. Okay?
Yes, sir. Okay, sir.
Don't disturb. If you will disturb, I will lost some necessary parts. Okay? We will do the lecture together, the interesting. Okay? If you will careful listening, I will try to give more information about this pathology. Okay? If not interesting, you can just stand up and go. But don't disturb. Let's imagine. We will go into the hospital. Suddenly we will meet the one patient, which with that patient hopes the help from us. Why? The patient have the pain in the leg and the ulcer. So the patient showed on leg, so we saw there is gangrene. Gangrene have types, you know, wet gangrene and dry gangrene, yes? So, and the patient have the wet, that dry gangrene. So, we decided to check the patient, to examine what we need to do. If it is previous time, so the more patients amputated with that. We should just stop, otherwise it goes up and then you will die. So that's why the more patient amputated the leg. Nowadays, after growing the modern investigation, we can prevent from the amputation. We can just stop in that one place. So I recommend you listen the lecture deeply, okay? And then we will together help that patient for saving the leg, okay? Let's go. Introduction part. We will discuss about the story, pathogenesis of the diseases, classification, clinical diagnostic investigation, and treatments. So we will not stop more about the story or something. Just we will go to the clinic, okay? In the present of occurrence of chronic arterial diseases actually of the lower extremities, it is approximately between the 40 till the 60. More we can, and then upper 60 we can meet more disease with the pathology. Critical ischemia, lower limb. You can see it brings to the ischemia, the stopping the blood in the lower limb and the upper limb. So gangrene looks like this. The following scientists have made great contribution to the study of occlusion disease of the abdominal aorta. So it is better that before the starting the pathology to know who worked on this field. So the firstly, Leriche worked, Heberer and Rowe, DBK and Crawford, Cooley and Wolmar worked on this in this scientist which is in foreign country. And then from the Russia, it was Petrovsky, Pokrovsky, Niazov and Smirnov and so on. And from our country worked on this Wahidov and Karimov, Shavkat Ibrahimovich. This is Leriche who worked on this field. This is Leriche with a colleague working on the one big the pathology, and they discovered about the Leriche syndrome. First pathology in the lower limb, it is Leriche. Leriche pathological area localizes in the bifurcation of the aorta. it brings to the thrombosis of the common iliac artery. It can be separately. It can be also the joint. Both iliac artery can occlude. So it brings to the clinical picture of no pulsation in the femoral artery and the intermittent claudication of the skin. We have seen, yes, claudication from this leg. You see the Leriche claudication. And the next importance of the diseases. Three big triad consists that Leriche. So next. This is of the arteries leading to occlusive diseases and geographic approaches for vessels. It divides diseases that cause code and diseases leading to the occlusion diseases. With the vascular diseases and diseases not associated with the vascular diseases. So if it is reason of the vascular disease, atherosclerosis, obliterative endarteritis, non-specific aortic renal disease, diabetic angiopathy, and then if it is non-associated with the vascular diseases, it can be renal syndrome, vasculitis, and the systemic sclerodermia. So the factor leading to arterial diseases, male sex, firstly, smoking cigarettes, and diabetes, lipid metabolism disorders, high hematocrit, hyperfibrinogenemia, genetic predispositions, and old age, obesity, hypodynamia, immune status disorder, and unwanted influence of the outside world. So pathogens of the chronic low limb ischemia, it is decreased blood flow and perfusion pressure in the main arteries, microcirculation, formation of arteriovenous fistulas, effects of vasoactive substance. Sign of chronic leg ischemia, pain in the legs, laments, cold snap, decreased sensitivity, and paresthesia for first stage, hypertrophy of the calf muscle, trophic disorders, hyperkeratosis, and thickening and fragility of nails. I think you have seen the getting the nail, yes? When you come, please. Okay, hurry up. Classification of chronic ischemic disease of the lower extremities by Pakrovsky. No, please go. Classification of chronic ischemic disease of the lower extremities. The first degree, it is cold feet, numbness, pain in the legs when walking long distance, more than 1 day, 1 kilometer. And the next degree, it is intermittent claudication appears. It divides pain at rest 2 weeks, ulcerative necrotic changes starts. So from this topic, I want to talk about the demarcation line. What is the demarcation line? You know?
Yes, sir.
Demarcation line. You see, there is lines which necrotic changes stops with it starts health tissue. That line which say demarcation line. You see it in this side also. There is also demarcation line, demarcative line. So this is necrotic changing. So diagnostics, inspection. What we should do? Firstly, inspection, palpation, and percussion we should do the patient. Where we can from which part we can palpate and do the inspection or percussion. There is necessary points which we should concentrate. If you want to determine the subclavicular artery, so from the upper part of the clavicle, we should press to the bone. The first bone we will press, and then we can feel the pulsation of the subclavicular artery. If you want to auscultate and listen the aortic pulsation, so in the you see the upper the umbilic, we can listen the abdominal part of aortic pulsation. So in this place and this place we can listen. If we want to listen the iliac, so from the pelvic area we can put our phanendoscope and we can listen. Okay. The next, for the determining the pulsation, also the same. We will listen little bit, press the artery to the bone, and then we can listen. We can feel the pulsation. So for the femoral, we can press, and then we can feel the femoral pulsation in the iliac area, in the inguinal area. Inguinal area. So measuring with the systolic blood pressure, so we should know about the normal, the changing, the pulse changing, pressure changing. The normal, the difference blood pressure between the arms, it is 5 till the 10 mmHg, and difference in the blood pressure between the legs, it is 5 and 10 also. But it is different between the leg and the arm, it is 40-50, the changing. And the LPI, it is 1.3, 1.4. And duplex scanning we can do.